How to know if pain in the urethra is from STD. There are over 20 possible conditions that you can connect to pain in the urethra. But how to know if pain in the urethra is from an STD? Each type of sexually transmitted disease has its symptoms. If you are experiencing one or more of the following, please see a doctor and confirm if you need immediate treatment. Gonorrhea symptoms. Gonorrhea is caused by an infection from the bacteria Neisseria gonorrhoeae. It can affect moist and warm areas of the body, which also include the reproductive tract, anus, vagina, throat, and eyes, besides the urethra. Symptoms may show 2 to 5 days after infection. On another note, some may not develop symptoms for several weeks, or may not show any symptoms at all. Besides pain in the urethra, you should take note of the following to determine if you have gonorrhea or not. 1. For men. Redness or swelling at the penis opening. Pain and swelling in the testicles. Frequent urination or having the urgency to urinate often. Painful or burning sensation while urinating. Having a persistent sore throat. 2. For women. Extreme pain in the lower part of your abdomen. Vaginal discharge. Painful or burning sensation in the vagina while urinating. Frequently having the urge to urinate. A bothersome sore throat. Occurrence of a fever. Pain experienced during sexual intercourse. Gonorrhea infections in the rectum may cause painful bowel movements, bleeding, soreness, anal itching, and discharge. If it remains untreated, it may spread into the bloodstream and cause joint pain, fever, and rashes. It may also cause inflammation in the nervous system, heart valve damage, and arthritis. If the infection goes for the long term in women, it may cause scarring in the fallopian tubes, pelvic inflammatory disease, ectopic pregnancy, and infertility. 3. Chlamydia symptoms. Chlamydia is another sexually transmitted disease that can actually be treated immediately to prevent complications. People who contract chlamydia may not show any symptoms, but if you discover that your partner has chlamydia, you must immediately take the necessary tests. Common signs of chlamydia include discharge from the genitals, vagina or penis, experiencing pain in the lower part of the abdomen, burning sensation during urination, pain being felt in the testicles, women experiencing pain during sexual intercourse. If the chlamydia infection reaches the fallopian tubes of women, it may cause bleeding abnormalities in between menstrual periods, nausea, and fever. The infection may also reach the rectum, which may cause it to have bleeding, pain, and discharge. Having oral sex with a person who has chlamydia may also cause a throat infection and lead to cough, painful swallowing, and fever. If the chlamydia infection remains untreated for a long time, it may cause pelvic inflammatory disease in women, which can cause damage in the ovaries, cervix, and uterus. The disease can also be passed to newborn babies, and they can develop pneumonia and eye infections. To avoid getting STD, it is highly advised that you use protection, since most sexually transmitted diseases spread during unprotected sex. Not using a condom, having multiple sexual partners, and not knowing the sexual history of your partner can lead to you contracting these diseases. Bacterial STDs can be treated with antibiotics if you start treatment as early as possible. Treatment at the earliest possible time can also prevent long-term medical complications, so it is best if you take to heart the tips given here on how to know if pain in the urethra is from STD, and seek medical attention immediately if you show symptoms.